NLN with the hard work that you're all taking on to try to meet the needs in this interesting health time for our country. But we do have education needs that continue to need to be moved forward. So we wanted to provide an opportunity to identify solutions and strategies and answer some basic questions that have arisen that might help us all get on track. One of the things we're finding is that our community of educators here at the National League for Nursing have been very, very generous with sharing their ideas and their resources, and we are extremely grateful for that. So and so that goes without saying. So I appreciate this, and I'm looking forward to the dialogue. I have with me 3 additional educators that have agreed to help facilitate this town hall with me, and I'm going to let them each introduce themselves. I know we had a little bit of a scramble trying to get online with you all, so for those of you, I never introduced myself. I am Sue Forneris. I direct the NLN Center for Innovation and Education and Excellence here in Washington, D.C. at our NLN headquarters. Just as a note, the NLN is working remote. We are on remote status now, and I am in the office. I'm one of 4 people in a very large office. I'm within walking distance. So I was a little uncomfortable coming here today because there's this need for us to socially isolate, but I am very isolated here in the office. So anyway, it's my pleasure to be here. Melanie?
Yes. Hi, I'm Dr. Melanie Cason. I'm from the Medical University of South Carolina in Charleston, South Carolina, where I am an assistant professor and I am director of the simulation program for the College of Nursing there. We have an accelerated BSN program. It's 4 semesters. We are now, the university is closed, but and our students are on spring break this week, thank goodness. But we are now putting everything online. So when our students come back, everything will be online for them. So, you know, I'm very interested to hear what other people are doing, as well as possibly offer some solutions for this really dynamic and flowing situation we find ourselves in. So thank you for having me, and I look forward to the conversation.
Great. Thanks, Melanie. Beth?
Hi, I'm Beth Hallmark, and I'm from Nashville, Tennessee at Belmont University, where I am the Director of Simulation for the College of Health Sciences and Nursing. We have multiple programs, including nursing, where our main concentration is for simulation.
Thanks, Beth. And Mary Ann? And
Hi, everybody. I have to unmute.
Oh, I was going to go, you didn't get on.
Hold on. I just forgot why I was muted. I'm Anne Rizzolo. I worked at the NLN for quite a number of years, and after I officially retired, have continued on as a consultant with simulation and other projects.
Great, thank you. So just as to kind of set sort of the tone so you understand the general direction that we are heading, we asked all of you to consider sending in questions so we could organize, because it's very hard to run a national webinar with opportunities for people to ask questions. It would be a little chaotic. So in keeping with that, we had you send in questions that were particularly troublesome for you, as well as solutions that you've identified that you'd be willing to share. From that, we were able to glean some key areas. And so these are the areas that we are planning to discuss in these 3 areas. We're going to talk a little bit about some of the questions that surrounded meeting requirements for graduation. I know many of you are trying to prioritize your online learning to meet the needs of those who are within months of graduation and taking the licensure exam. And so we for sure want to talk a little bit about that. The other is another area that garnered a few questions was in the area of securing testing methods. How do you test online, and how do you have environments that are secure to minimize as much as we can the issues that students have with working around the boundaries. And then the most of all, and we'd like to be able to, we're going to talk about those two areas first, and we will move on quickly from those because some of our particular responses and things that we're gathering from around the country are very specific to states. And so we'll talk a little bit about that. And then we'd like to spend the majority of time talking about this notion of creative teaching and learning, both online and substituting SIM for clinical. What might that look like? Those are the main areas. Disregard the letters on there. We were doing some sorting of a spreadsheet, and I'm sure that you're probably wondering what that refers to. So that's what that refers to. And so we'll disregard that. So I'm going to kick off each one of these topic areas. We're going to spend about 15-20 minutes total in between the first two bullet points. We'd like to spend the majority of the time addressing creative teaching and learning. We are going to ask you, as you have questions, one of the things that would be helpful to us is when we get to the end of each of those sections, if there's a question that we haven't really tapped into that you have, you might have to turn your video screen on, and if you click on the participants icon at the bottom of the screen, you will see all the participants come up. You need to find your name, or at the bottom, raise your hand. So that way we'll know who to call on. Might be the easiest way when we've got so many people online than trying to unmute microphones all of a sudden. So if you want to play with that feature, that would be really helpful. The first area, as I mentioned, was what we're going to talk a little bit about is meeting requirements for graduation. And this really seemed to be one of the more pressing issues in this area right now. And I think the questions that came up, and I'm just trying to find the thing here for you. You know, how do you prepare graduating students well enough for alternative clinical assignments and prepare them for the licensure exam and meeting their requirements? I think one of the themes that you're probably going to hear from us is that the NLN doesn't have a formal position on any of the regulatory requirements for graduation. And so what we usually direct our educators to do is if you're looking, because all of your face-to-face clinical courses for capstone as such are now being canceled, would be to have conversations with your Board of Nursing. And I know many of you have started to do that. They are the ones that guide the amount of clinical hour requirements for schools of nursing within each state. So you really have to start there and find out if they're having any conversations on what to do in this particular situation with clinical placements being canceled and students not allowed in hospital facilities. How do they continue to meet the remaining amount of hours required that your program requires, that probably is guided by Board of Nursing and accreditation for how many clinical hours meets graduation requirements. For those of you who might be from states where the Board of Nursing has not made a determination on how much SIM can be substituted for clinical, what percentage. Many of them, a place to start would be to go to the NCSBN website and pull down the guidelines that the NCSBN put out to boards of nursing to help guide them in the promulgation of rules that would guide schools and or guide the boards to make decisions on how much substitution of actual clinical can be used for SIM. The study is up there, and many boards of nursing have used those guidelines to help them make determinations. So the first thing to do is, if you don't know, is to find out if you want to replace your canceled clinical with SIM. What's the substitution being allowed by the state? 25% of the SIM, 50%, 10%. Each state has done something different. If the state you're from doesn't have a recommendation and they're in the process of making that decision, there are guidelines in the actual NCSBN study that you can use as evidence right now, and that's what many schools of nursing and states, you know, have looked at in terms of making that decision. I'm going to stop there and just ask if there are any comments for faculty out there listening who are in the middle of those conversations, and what things you have used. I see also, and thank you, Sabrina, I just saw your chat pop up. INACSO, the International Nursing Association of Clinical Simulation and Learning, also guides the practice of simulation through its publication of standards, and the NCSBN guidelines recommend the use of those standards in any type of sim that you're using. So that is an additional set of evidence to guide best practice in the use of sim, so that people making decisions around this at boards of nursing who may not be adept in the area of simulation at least know that those there are standards out there. Between any of my 4 facilitators, is there anything that you would like to add just around the substitution of sim for clinical?
I'll speak to that. I would like to say that if you're not aware, do look up your board's position statement on the clinical substitution. Not all states have this. Some do not have it. But irregardless, if you're in a situation with replacing clinical with simulation, you do need to have your leadership approach the Board of Nursing for clarification. And the sooner the better. I know in South Carolina, we do have a position statement. It's about 2 years old, where we can replace up to 50% with high quality simulation guided by the NCSBN and ANASCL standards. However, we may have to go over 50% in one course, or who knows how long this is going to really last. So the board has been approached, and they are having a meeting next week to discuss. So your board is probably on this already, but if not, talk to your leadership and find out what's going on with that. Make sure you have good communication with your leadership.
Thank you, Melanie. And you made a nice segue to the next area in this, and that has to do with how do you define SIM, quality SIM. And in light of the fact that you can't be face-to-face on campus, then the only other option would be videotaped or virtual SIM. So we'll get into some of the creative options for using SIM not face-to-face when we get into creative teaching and learning. I will say that virtual simulation, for the most part, has not necessarily been spelled out as part of the definition of high quality SIM. And that is another conversation you need to have with the Board of Nursing. If face-to-face is out and there's very good virtual products out there already, then you may have to approach it on a case-by-case basis. But in most cases, virtual SIM has not been part of the SIM that can be used to substitute. So I would clarify that individually with your Board of Nursing, and in light of conditions with cancellations, then that's probably where you need to go. So vSIM and virtual SIM and any type of non-face-to-face is up in the air. But considering we can't be face-to-face, I'm thinking there got to be some, boundary bending on that a little bit for this crazy time, especially for people in capstone areas. So that's just one thought.
So This is Beth. I'd just like to say one thing. Our State Board of Nursing also does not mandate how many clinical hours each course should have. And so that's another consideration too, making sure you know exactly how many clinical hours your courses are required to have. And that will help you determine your 50% of how many hours.
We'll continue on with more virtual creative solutions for those of you who aren't in this where you want to bring it into the classroom because the students can't be face-to-face, and offer some solutions. We'll get to that in a little bit. And then the second question that came up was, and so that kind of covers this notion of graduation. I think much of this resides with boards of nursing, and so it really means across the board from anything from pre-licensure on is you're going to need to check with your board of nursing or clinical credentialing areas. Be familiar with your accreditation requirements and how much they're going to look to your board of nursing and rules that you're following in your curriculum that builds on that. So if you have a tight curriculum map and you have conversations with your boards of nursing and justification, you should be able to map that back in terms of identifying areas of solution or issues and solutions relative to accreditation. The other area was about secure testing, and yeah, we get that for sure. What the question that came up the most in this area, let's see here, I don't have any, was how do you, if we have to go to online testing, how do we keep it secure? I'm going to speak to things generally. One of the questions that comes up with is whether or not your tests are tests that are being generated outside of a learning management system. I can't speak to that because of what I can speak to is our learning management systems that have the testing capability built into the LMS, such that you have question banks that you're building within the learning management system. Most learning management systems, and if you don't know this and you're getting new to functioning a little bit more integrally with your LMS, is to ask your instructional designers or IT support areas or the manufacturer of the LMS as to whether the LMS has a feature when you're generating a test or a quiz. There are some features that are used to prevent cheating. And one of them is to prevent the students from right-clicking on the mouse, to bring up other things, and to have a lockdown browser. So when the test is initiated, the browser locks down and the student is unable to go to another browser without closing out of the exam, which would give you an indication that a student went outside the testing environment, and you can question that. Now, the other question that comes up a lot is, well, that doesn't help us if they're, we can't see them. So how do we know that they're not texting students back and forth and whatnot? So one of the solutions that was presented to me that I thought was rather creative was to set up Zoom exams where you have a proctor and specific proctoring requirements for a group of 20 that are going to be on Zoom at the same time. And it involves scanning the environment, making sure that the student, before they start their exam, their camera, they can show you exactly what's on their desk. And many of them are saying everything is off the desk except your computer and a white sheet of paper. No phones, no nothing. And so that they have to show they've scanned that and then put it back up. So, and then they have to stay in that position on their computer. Short of having someone in the room, you have to be in a room. You cannot allow people to come in and out of the room. So there are some different ways in which you can think about proctoring and having individual faculty proctor a room of 20 Zoom students. And then they have to show their screen when they click out of the exam that they're cleared out of the exam, and show that to their chat, put in the chat feature that they're clear on their exam, and then they exit. So there's ways in which you can talk about creative LMSs to do that. That's one situation, and there's a lot of stuff coming on the chat feature about that. Our intention is to take some of these things from the chat feature and see if we can't come up with a final document to send out to you that might provide some simple bullet points of things we've just mentioned. So in those, given that, does anybody have a particular question that falls outside of those things I mentioned for either board requirements or assuring graduation requirements, as well as secure testing that you'd like to call out? And I can't see everybody's screen.
Hi, this is Melissa Snyder from Eastern University in Pennsylvania. I'm just curious, right now our students currently do all pencil paper testing, and we'll be transitioning to online testing in our LMS. They have done some minimal formative evaluations using that system previously, but we have decided to use only the forward navigation and some other things to try to secure that testing environment as much as possible. I'm curious whether you have suggestions for best practices to transition the students in an expeditious way from pencil paper testing to online testing with some very specific guidelines for how they can manipulate the testing environment.
Well, one thing to consider is fair testing guidelines to begin with. So before you would have a student take an online exam that is going to be an exam that has a relatively important outcome for their grade, whether it's a unit exam or something like that, you might want to institute some in-class quizzes that you can use online that give them a chance to get comfortable with the test environment. Try and use some of the can't go back and repeat a question, only forward motion, lock out the browser if you have that option. Things that give them a chance to experience it before they actually have to take a one that's going to be a big boon. So you could even do it as a formative classroom assessment technique. They don't count, but at least it gives you some detail and information on where they're falling in the topics you're teaching them. And then when they take the actual exam, it won't be such a, you know, like a, oh my gosh, you know, the stakes are high and the nervousness and anxiety. They're familiar with the environment and know what to expect. That would be my one suggestion.
Yeah.
Does that help, Melissa?
That does. Thank you very much.
Okay, thanks. All right, we want to spend the majority of our time on these creative solutions. And so there were some areas that came up in creative solutions that that fell into 5 areas, and we're going to speak to each one. One was, how, for those of you who are teaching in courses with hands-on skills, how do you do that online? Another area had to do with, we're really trying to move to engaging more critical thinking, and if we can't be in face-to-face and manipulating things, and how do we, you know, we get into critical thinking online. Evaluation of learning online. For teaching in the community, since nobody can go out anywhere, how do you get community health experience? And what kinds of solutions are there for that? And then to just, if we really want to start using more sim, but now we can't even be in our labs face to face, what are some other solutions for bringing in a hands-on kind of an approach with simulation in a virtual or a remote capacity? So we're going to start with the topic around hands-on skills, and I'm going to let Beth and Melanie share some of their thoughts about that and the questions that came up in that area.
So this is Beth, and in terms of skills, some things that we would recommend or that we have known that other people are doing is, of course, the ability for students to use vendor videos or videos that may be out there, or even videos that you may be able to go into the lab and make to do some of the pre-work or training for the students to do those skills. And we also talked about, while maybe not optimal, if students have their kits with them that they've taken home, they could videotape themselves possibly giving medication or some things that they may have at their disposal. I do think it would be difficult to do things like Foley's and some other things, but you would be able to do some basic things possibly if they have a kit. I do think that skills is one of the harder things to manage. Another thought is we are looking at, actually, because we're concentrating on our seniors that are really thinking about graduation and they've gotten 99% of their skills out of the way, we are thinking about these students are going to be here several more years, a couple more years. So we're going to move some of those skills that we need to the beginning of the following semester so that they have time to practice, maybe watching videos or doing some things on their own, and then they will actually come back ready in the fall, if we're ready to come back in the fall, and actually do their evaluation or check off on the certain skills. Melanie, did you have something else?
No, just to recap all that, I think videotaping, the students videotaping themselves or having someone videotape them at home doing a skill is a good idea. Fortunately, we have front-loaded our skills and foundations, so they should be pretty good right now. And like in this situation, we're focusing on our graduating seniors and our students that are also in Med-Surg 1. Beth had a great suggestion. We were chatting earlier about using previous taped simulations after you get permission from the students that were in those taped simulations and using them for the students remotely to actually participate in a sim as far as pre-briefing and then debriefing the sim with them online. I love that. So thank you, Beth. But as far as skills go, really, and we don't know how long this is going to last. So if it lasts into the summer, hopefully not the fall, I would recommend like heavily having the students view vendors' films, videotapes, checklists. So when they do come back to campus, we can hit those skills in a hard way with psychomotor skills to have them practice and be checked off. It's just going to be more prep work. And that's really all I can think of at this time. Any questions?
Hi, this is Roland. I represent West Coast University here in Los Angeles. Somebody mentioned about the kits for students. We usually, I've never heard about that. Can somebody probably expound on that one? Like, do you give students the kits? Do they have to purchase themselves? Very interesting.
Yeah, well, it's like a lot of schools do this. They have nursing kits with supplies in them that the students purchase, or the college purchases for the students, but usually it's a student purchase, like a book would be, or online subscription to a book. It's has things in it like dressings and a Foley kit, suction catheters, sometimes different things depending on the school. You can customize them. If you don't have that, if they don't have that, then I don't know how they could demonstrate anything beyond like maybe health assessment, that sort of thing, where they didn't need supplies.
That's a great idea. I'll probably bring that up in our school, but thank you for that idea. Appreciate it.
Anybody else that has a question at this point? Okay, we'll move forward, and we're going to kind of shift now to the notion of addressing some of the questions on how do you prioritize some creative learning to really focus on the critical thinking. I know with the emphasis now with the change in the direction the NCLEX test will take, having clinicals canceled and face-to-face canceled in light of this, I think ups the ante a bit on challenging us more with critical thinking activities. So Melanie, I know you had some thoughts, and we're going to share some of your thinking around that.
Well, first of all, I just want to emphasize, especially to those of you who have done no online teaching, and that can be very daunting when you first start, and usually you have time to prepare and learn about it, and now here you go, right? So the thing I want to emphasize is creating a community in your classrooms online. And it's okay to say to your students, we're all in this together. This is new to me, it's new to you, and we're going to work through this and we're going to make it. And just having that sort of positive attitude with your students during this time can go a long way. I've been teaching online now for 13, 14 years. But when you first start, it can be difficult. And you're transitioning. Some of you have like a hybrid where you have some things online and you've been lecturing in the classroom maybe 2 or 3 hours a week. So this is a huge transition. And you want to make sure that you're not just going to film a 2-hour lecture and put it on there. That is not going to promote critical thinking for your students. You can assign them things to do online or whatever, and then, but your focus, your videos, your panoptos or whatever you're using to record should not be longer than 10 or 15 minutes to summarize, emphasize, clarify. Use the live features in your learning management system too, where Moodle has a collaborate feature. There are other features where people can come into chat rooms and you can interact with students in that way. Critical thinking, you just don't want to be lecturing. You don't want to go back to the old model. You cannot use what you have been using in your classroom online, more than likely. So I just wanted to emphasize that. You can give case studies, you can have conversations with your students online, and you can use all kinds of creative processes that are available in different learning management systems. You're just gonna have to, if you haven't done it before, you're gonna have to play with it. And view it as an opportunity to increase your tools in your toolbox, and don't be afraid to try things. I've never broken one, so I think that this is a great opportunity for you to expand your skills.
Great. This is Beth, and I have a couple of ideas too. A colleague of mine at another university has been teaching in a program that's a totally online program, and she has a way to do simulation where she is actually the hands of the nurse. And so the students log in via, I think she uses WebEx or no, Adobe Connect or something like that. And they log in and they tell her exactly what to do. She does nothing. And at first I thought it was kind of an odd way to do simulation, but I've watched her do several videos she sent me, and we actually practiced it here. And she even, like my students actually, or we did it as the faculty, told me, you know, wash your hands, check your armband. And then the vital sign monitor is showing up on their Zoom or their virtual, or their LMS system, which we use, and they were able to tell us what to do exactly. We were giving them the assessment findings that we were finding, and they had to use critical thinking to decide the next step of what they would do. And it's actually been it was very, very effective. And so that keeps the students out of the lab. We're the only ones in the lab, which we're at this time able to do that. And then Melanie also talked about some other ideas that we can talk about later when we get to some other creative things.
Are you taking questions, or I mean solutions?
Sure, we'll take 1 or 2 here before we move on to the next one. Is it surrounding critical thinking?
Yes, it is.
Oh, great, thank you. What's your name?
Good. I'm Pat Kyriakides, and I really appreciated both Melanie and Beth's comments about how do you move toward clinical thinking. And so I just wanted to offer a possibility, and that is NAVEX, Novice to Expert Novice to Expert Learning with Patricia Benner is offering a virtual learning possibility. It's an immersive, and the focus really is on problem solving, which begins with thinking, or thinking begins with problem solving. So we have over 50 cases for both Clinicals 1 and Clinical 2 replacements, so that they are moving from more simple to complex patients across med-surg. And the real focus is, we don't give them any information about assessment. They have to find it, and then they have to make sense of it. And then, so the clinical thinking is upfront and really part of what they do. Thank you.
Thank you for that. I think the other area, as you think about critical thinking, that I'll just add, and then we'll move on, is any opportunity you have in the work that you do with students to engage them in a dialogue, either virtually through Zoom or in a discussion, where they have to provide the rationale behind their thinking. So they're the ones telling you, well, this is what I would do next, and here's why, so that they get in touch with the knowledge guiding their thinking. That is, you know, they've got to create some neuronal pathways to knowing they're on track, moving in the right direction in the way they go from A to B to C. And the only way we're going to get them there is to continually get them to rehearse that. So sometimes it means they have to tell, you know, you, not that you want to hear the right answer, but you want the right rationale for the answer. So any opportunity you have to create small case studies with discussions with small groups of students where rationale is provided and students play off of each other is active learning, and it gets at their critical thinking. The next area, and I'm going to kind of move them together, is this notion of covering community health. And I think it's the same idea, you know, with anything. If you have to move virtual, and since we can't be out and about in the community with trying to be socially responsible with our isolation, is to provide virtual opportunities. And so one of the areas that is emerging across community health nursing is the use of telehealth in rural medicine. So if there are ways in which you can create telehealth sims using Zoom with your learners, might be the one way to approach that in a more, I would say, pragmatic way. Getting faculty to act as SPs that students aren't familiar with those faculty, to bring them on and have students do some assessment, and especially if they're moving into community, there are ways in which you can create environments in people's homes and just Zoom from there. It's linking a little bit outside of the box, but telehealth is an up and coming. I mean, it's been alive and well for the last 5 years in rural communities for mental health and many things. So I think we need to think a little bit about how to create those environments. There are virtual strategies as well that are part of virtual simulations. We know Walters Kluwer has a community health simulation product that you can use. There are Second Life, people that have done things in Second Life, where they've put students in that and created a world where they have to do a windshield survey by walking around the environment. So you might want to check on those resources if you're in the middle of a community health situation and you have to provide some clinicals. That kind of moves us into, if any, I'm kind of transfer over to Beth, because I know you were going to talk about some different ideas in regards to bringing sim from face-to-face into a virtual or videoed environment.
Yeah, and real fast before I go to that, the University of Minnesota School of Public Health also has a course that you could use for community health, along with a couple of others that we'll add to our resources. So I found a couple for my community health faculty that they've sent me in the past, so we'll add those. So the one idea that I gave earlier about doing the virtual simulation where the students were having to direct the faculty. Some things I want to think about too in terms of thinking about the NACSL standards. We are recording or doing a pre-brief before that also, making sure we're integrating those standards and doing a pre-brief, and then doing the sim with the students, and they have to either live chat you what they would actually do, or verbally log on through the LMS and tell you what to do. It depends on your group. We're also trying to see how we can get so many students through. That's one of our big things. So we're going to flip our group so that some of our students are participating in the actual sim and giving the next step, while the others are observing, and then we'll be flipping those. So that's another way that we're doing that. And then we're going to do a pre-brief, and that a debrief, and that debrief is going to either be via Blackboard or your LMS, where they have to answer questions. And then we're also going to offer 4 live sessions where they would have the opportunity to participate in the debrief. Another thing that we're doing, which Melanie mentioned earlier, is we have been able to go back and ask permission from certain students that have we have videotaped sims over the last semester, because we save all of our sims for 1 year, and they have to sign a video release saying that what we're going to do with that, and that if we're going to use it for educational purposes, we'll ask further permission. So we've asked further permission from those students. For instance, we're doing a end of life sim, which is really critical to our curriculum, and we want to make sure that it's one of our concepts that we're covering. And so they have a pre-brief that's videotaped. They watch a previous group of students doing that sim. Then they do they have an MAR that's actually up there for them. They have a patient report. They have all those documents added into their LMS. And then they have to do some reflection on some certain questions, because it's an observational type. And there's actually some literature that I think we're going to share with you in terms of how observational sims work and what that is. And I think Sue has that citation for us. So we're actually, after that, we're also going to schedule some live debrief sessions so that those students can actually participate in a debrief. We really wanted to do this for the end of life sim, especially because that can be a really hard topic for students to think about and deal with. So we want to make sure that we're providing them plenty of emotional support after simulations, because it can be an emotional time, and we want to make sure that we're using that debrief time effectively.
One of the, the other areas, as we think about the videotaping, as we think about face-to-face and SP, is to, there's some resources that we've heard where they're actually running a mannequin live videotaping. The faculty person would videotape the mannequin in the bed, excuse me, and the metrics, and do an unfolding case. That's another solution to sim, where you can have small groups participating on Zoom and telling you what they would do next, and then the video continues to unfold. So it takes a little bit of creative solutions, and I know some of those solutions were shared, and so we're in the process of getting permission, and we'll include that as another idea for those of you who might be on limited budgets and can't purchase virtual products at this time, as another way in which you could take a look at using an unfolding case, using a simulator and running it live.
And Sue, the NLN ACE cases are so good for that too, and those are all on the NLN website. They're free, and they have monologues that are recorded that are really great. You might talk about that later, but I just wanted to throw that out there.
Yeah, thank you. Any other comments about creative? Those were just a few. I want to get to evaluation of learning too, but if anybody has a really great idea they're willing to share and would like to share that now.
I think just being aware that the vendors are out there, and if you are interested, approach the vendors. Some are offering free trials, some are offering 50% off, or some are offering a limited trial for 30, 60 days, and really look at the products. They range from, there's no way to tell how long your student has been on this product, to where they can take a screenshot. and upload it online so you can see. But the vendors are very active right now. So if you are a simulation director, you're probably already getting these emails and offers, and just look at everything. Someone in the chat room just mentioned Ryerson University virtual healthcare experiences in Canada. That's free. Very, very interactive, very good. We've already used a few of those. Montgomery College has videos in their simulation library that are available. Just look at everything. It's really a great time to be looking at everything and deciding what's best for your program and your program's objectives.
The other two
outcomes.
Yeah, the other two that, vendors, of course, that are strategic partners of the NLN are Laerdal Medical, and Walters Kluwer, which collaboratively put out VSIM for nursing. And those are authored by NLN simulationists. So those are, I would also reach out to those vendors as well, those companies. I want to move to evaluation. I know evaluation of learning, we brought up a little bit in terms of the online testing and some of those pieces, but I know Mary Ann has some thoughts that she'd like to share on that. So Mary Ann.
Hi, everybody. I think one of the things that I think we all need to be aware of is that you guys are so diverse. You're coming from big academic health centers, you're coming from small rural community colleges, practical nursing programs. And so while, lots of ideas are floating around out there, it's your decision on what is going to work for you and what are the resources that you have at your place that can help you adapt some things you already have, or help you find resources out there that you can use both for teaching and evaluation. And I think, but the main thing, I think, you start with your objectives. What are the objectives? What are your course outcomes? And for every course, you've already accomplished some of them. I mean, I don't think most of you are probably close to the end of your semesters or trimesters. And so take stock of, where are all your students and what's left for them to do. And although, we've talked a lot about sim and virtual experiences, go back to some of the basics too. Are there assignments that they can do in writing? Are there journaling things? Are there other creative ways that they can demonstrate what they know and that they need to know before they exit that course? So, don't limit yourself to the kind of sexy things, go back to the basics too. And, some of it may be, there's going to be variation in the class too, because some of the students are much further along and able to handle the disruption much better than others who are kind of struggling. And there were some questions that came along that I think everybody needs to think about how do we reduce stress in students at this time. And if we're throwing a lot of new things on them and are going to be using evaluation methods, I think we need to be mindful of not increasing their stress and anxiety. And as Sue was mentioning before, preparing them for some of these things in advance, go through them if it's something new so that they have their best shot at doing well with the evaluation pieces that you decide to do. And as people are mentioning on the chat room here too, all the different places that you can get sims and use Zoom perhaps, or create some products, modify some products that would be unique to you. There are tons of sources out there. The Society for Simulation Healthcare, their open discussion, has lots of people joining in and sharing their experiences. And I think collaboration is particularly important at this time. Collaborate with people that are in like situations to you that can share things that have worked, whether it's perhaps your NLN constituent leagues, you know, could offer some things together. And there are tons of things that you can adapt. But I think, talking about the SSH listserv, I invited someone who shared some unique things that he was doing out in the state of Washington, because they were hit first. And he, for example, took some VSIMs, put multiple ones on the screen at the same time, and had students prioritizing among a group of students, a group of patients rather, which is something that, you know, most of us try to do in that capstone course at the end of the program. So there's lots of great ideas out there, and just reach out. I think it's a wonderful, people are sharing. I mean, just look at the comments that have been made during this hour. Share and collaborate is my best advice.
Yeah, I think too, Marianne, some things that you said is we always have to begin with the end in mind. So I know a lot of us are scrambling, you know, to think about, well, how do we know they're ready for practice if we can't, you know, test them? And, you know, I think that sometimes we have to go back. That one final test is not, you know, licensure make, and so you have to kind of look at the student cumulatively. That's why you have learning outcomes in some cases, or program outcomes that cover different aspects of what it means to be a professional nurse. So it may mean collaborating to decide what are some key, you know, at least accreditors sometimes ask this, what is a key performance indicator that a student has met a program outcome or course outcome? And maybe it isn't a live face-to-face thing. It might be more of their thinking on paper and in other ways in which you can ascertain that. And so there are ways to look at that and collaborate with your colleagues within the institution to take a look at some other ways in which you can create a well-rounded portfolio of learning to verify that the learner is on track.
Fran raised her hand.
Sure, and I caught a question too that I want to go back and ask Melanie to address, but go ahead, Fran.
Hi, this is Fran Camp. I'm from Atlanta, Georgia. Something that came up in our task force meeting yesterday is that we have to be really careful that we're not introducing too many new resources to the students and or cost to the students. So for us, it was what can the college absorb if it's coming down to cost, and then again to be careful with the resources. My question I had asked a little bit earlier, though, is there are a lot of free resources out there, but how do we equate the time for simulation? So for instance, if we decided to use the ACES simulation, we actually work on a 2-to-1 ratio. So how do we even come up with what the initial time frame is, no less than 2-to-1 ratio, for how long it would take students to run through some of these virtual simulations and give them credit? Because for some of our seniors, we're looking at them actually having to make up 60, 70 hours still.
Well, I know it goes back to juggling your credit hour calculations, because, you know, of course, it's a bigger question of, you know, are you watching them every minute they're in their precepted experience or in clinical? And we know that that's not the case. Instructors don't see a student every minute of the day. So, you know, if you're a 2-to-1, how many hours are you going to need, you know, for them to do? And how can you capture that in a, for instance, if you were to hold as best you can, I know for some synchronous doesn't always work given situations, but to hold sessions where they actually run through a case study or sim with you with small groups. So it's, instead of them going to the sim lab, how do you do it online, walking them through the thinking and, you know, the unfolding of that. If they're not testing situations or high stake situations, which in some cases we're not recommending, but more formative, then it's an easy dialogue. It actually becomes a dialogue of thinking on next steps. So I think part of it is you're going to just have to count the hours. What does 2 to 1 mean in total amount of hours then that you would be spending, and divide that up. I don't know if that gets at what you're asking, Fran, but it really goes back to the spreadsheet and counting hours.
Yeah, I'm not so concerned about the 2 to 1 as I am, for instance, like I've never sat and done all the ACEs simulations. So is that something that would take students an hour to run through, or is that something that students would take 10 hours to run through? That's where my biggest question is.
Yeah, I mean, I think, you know, and just so we're clear on ratios, because I know that was another question that came up, and we're 1 minute to 3 here. You know, there are 2 different types of ratios that people need to consider, and not to confuse it, but there's the ratio debate going on right now about whether or not sim can replace more clinical hours. So instead of 1 hour of simulation equaling 1 hour of clinical, 2 hours of sim equals 1 hour clinical. That debate hasn't been decided anywhere by any board of nursing or any regulation, and there's literature coming out on that, and I will put up a citation of the most recent study. That's one ratio. The other ratio that has been long-standing is the ratios that come out from the Department of Education that guide all colleges and universities around how credit hours are determined. So classroom ratio being 1 to 1. You know, for a 1 credit class, it's 1 hour of classroom face-to-face with the teacher for 15 weeks. That's 1 credit.
Right. No,
So I just want to make sure. And then there's a 2 to 1, you know, lab is 2 hours of lab equals 1 hour of lecture. And then clinical or some sort of field experience is 3 hours equals 1 hour of lecture. So that's the ratio we're talking about here relative to credit hours. Are we on the same page, Fran?
yes and no. I'm not even talking necessarily about the ratios. I'm talking about how, I don't know how some of these how long these are going to take. So if we decide we're going to go all virtual, you know, do I need to assign 10 ACEs simulations to them or 5? And, you know, I just don't know how long all these things take for students to go through.
So in an online environment, it's going to vary too for the students.
Yeah, that's what I was going to say, Melanie. It might take one person 4 hours to do a virtual sim, and it might take another person an hour to do it, depending on how comfortable they are with technology and how comfortable they are with the situation in the simulation. So we have standardized that we're giving, and I'm not saying that you should do this, I'm just saying we had to make a decision. So we decided if we would give a set time for each one, and it's different for whatever we're doing virtually. So we're setting it, and if it takes you 4 hours, it takes you 4 hours. If it takes you 1, you get 1. I'm not sure that's.
You might, you know, the other thing too, Beth, is the other way to consider it is always bring it back to, if you had to do this in the classroom or lab, how much time would you allot for it?
Yeah.
And then there's your answer. That seems to be the more standard rationale, because you're going to have to back up with, how did you cover this? Well, how much time would you allot if you were doing it face to face?
Yeah.
In a lab setting, you can't use homework hours in this. So that's what I guess I would, is bring it back to the classroom or lab, and how much time would you allot on a lesson plan for this activity, and that should give you a ballpark reasonable answer.
So for instance, Sue, if I was doing a virtual sim on a MI or a code, how long would it take us to do that code in the lab?
Exactly.
That's how much time we should give. And then,
exactly.
Great, I like that plan.
Yeah, I just think it makes it easier. Well, we've hit our final 3 o'clock hour. As I said, this was recorded, and Andrea will be putting up where you can locate this. We are going to take all of the comments from the chat feature. Andrea, I'm sure, is diligently been taking them, and we will craft some talking points and get those posted on the website as well. But you know, in light of the dilemma we're all working through, here are some final thoughts. You know, your course outcomes and objectives out of your Bible, go back to your curriculum map and link everything back to that standard right now. Make sure you're working as a group to get buy-in. Keep it simple and adhere to the standards. Be creative as possible. You know, time is short, and you know, just don't expect perfection. So I hope this was helpful for some of you to get your thoughts spurring and ideas. We thank you so much for your time and attention and your involvement with all of your comments, and you know, thinking about you. And if stuff comes up, please don't hesitate to reach out to the NLN. We'll do our best to provide you with resources and answers, or direct you to where we think you could go to get the answers. So thanks, everybody. Thank you to my facilitators, Beth, Melanie, and Marianne.
Thank you.
Thank you.
Thank you.
Bye.
Bye.